Welcome, everyone, and thank you for joining us. My name is Natasha Musavi, and I'm the Associate Director of Online Learning for APIC, and I will serve as your moderator today. The Association for Professionals in Infection Control and Epidemiology is pleased to present this webinar titled Preparing for the LTC-CIP Certification. Before we begin, I would like to go over a few items for our attendees. Please note that this presentation is being recorded and will be available in your APIC Education dashboard within 24 hours. You will receive an email notification once it is available. We encourage you to submit your questions at any time during the presentation using the Q&A tab at the bottom of your screen. If you need technical assistance, please send us a message in the chat box or send an email to elearning@apic.org. APIC is proud to share that this webinar is available for live translation in over 25 languages through Wordly, which uses artificial intelligence for real-time text interpretation. You can read along in your preferred language on your computer or mobile device. To get started, click the link in the chat. This will open a new browser window, and from the drop-down menu, select your preferred language, then click Attend, and the program will begin to transcribe the live audio in the language you've chosen. Please note, you may have to move this new browser to a second screen to view the live webinar as well. As a general disclaimer, these slides are for informational purposes only and cannot be used for other purposes without permission from APIC. And now it is my pleasure to turn the program over to our subject matter experts who provided their expertise to create the study materials you'll hear more about today. Deb, welcome to the program. Could you start by introducing yourself and perhaps providing some background on your experience in long-term care?
I'd be happy to. Thank you very much. And thank you to everybody for hanging in there and participating and your interest. I can tell you this was truly a labor of love from all of us. My name's Deb Birdsall. I'm a long-term care infection preventionist. I started in congregate care settings in 1974 as a nurse's aide, and about the only thing I haven't done as administrator. I'm board certified in infection prevention and control, CIC, but I also just recently passed the long-term care CIP, which we're going to talk about today. I now work as a consultant and support state health department infection prevention and control, specifically using the CDC infection control assessment and response, or ICAR process. Evelyn?
Thanks, Deb. And I'd like to add my thanks to everybody that joined us today. We're so excited about the topic and also very excited that you could join us today. So my name is Evelyn Cook, and I'm the Associate Director for the North Carolina Statewide Program for Infection Control and Epidemiology, kind of better known as SPICE. And in my role, I am one of the primary lecturers at our courses that we hold, but I'm also provide education and consultation really to every healthcare facility. Not only in North Carolina, we also get queries from other states. But one of my major roles over certainly the last 5 or 6 years has been working with long-term care facilities, nursing homes, providing the ICAR assessments that Deb mentioned, also just a multitude of educational activities. And we are so excited that we now have the certification for you guys that's, specifically for you, and that we have this opportunity to help you prepare for that. So Jackie, I believe you're next.
Thank you, Evelyn. Yeah, I share the same sentiments. We are so excited to be able to offer this, and it truly was a labor of love over many months. I have over 30 years experience in short-term and long-term care in the infection prevention field. I've been certified since 1991 in infection control, started in '89. And my current role is within the Florida Department of Health HAI Prevention Program. I oversee the Project First Line educators throughout the state, and our focus is long-term care settings, although we offer educational support to all healthcare settings. And the educators also provide guidance as it relates to infection prevention and control program development. So I am so happy to be here, and thank you for participating today.
And good afternoon. My name is Linda Bean. I've been certified in infection prevention and control as a CIC since 2011. I'm currently a long-term care infection prevention and control consultant. After working for many years with a large long-term care corporation as an infection preventionist. So without further ado, I'm going to turn it back over to Natasha so you can hear about the wonderful program that's been developed to help all of you when you sit for your exam. Natasha?
Thank you, Linda, and thank you all for taking the time to give us a brief background for all of your experiences. Fantastic, thank you. So for today's program, we will provide an overview of the study tools that will be available as part of the learning system. Our subject matter experts will share how the content was created and the rigor that went into reviewing the material. And finally, we will save a lot of time at the end to give you the opportunity to ask questions. So please use the Q&A feature to do that, as we want to hear from you. And with that, I will turn the program over to Letty Klutz, Vice President of Education and Events for APIC, to give us an overview of the new APIC Learning System.
Thank you, Natasha. I echo our SME's thanks to all of you for joining us this afternoon. This is 1000% been a labor of love, and I am just really, really excited to be able to share some information and give you a high-level overview of the APIC Learning System for the LTC-CIP. So I want to first start by stating that our goal was to create a course with content and tools that will not only help prepare you, but also to pass the exam. So I'm really excited to give you a high-level overview of the learning system. I did want to do just a side note that all of the features that I'm about to talk about are also going to be part of the learning system for the CIC. We will be launching that later this summer. And I share that because we received a lot of feedback from our current CIC materials about desired features and tools, and we took all of that feedback to heart. So I'm very pleased to share that this learning system includes most, if not all, of the features that people have been asking about for years. So I am going to talk a little bit more about the study tools. Next slide, please. Thank you. So this just highlights some of the study tools that are available to you as part of the learning system. So one of the things that I want to highlight very quickly is when you get access to the learning system, one of the first things that you will do is you will take a pretest. And this pretest really is also, you can think of it as an online assessment. This is going to allow you to see, okay, where are you strong and where may they be areas of opportunity or gaps in your knowledge that you really want to focus. So all of that is to say is that you can actually customize your study plan based on where you are when you take that pretest. And so part of this learning system, all of the modules include quizzes at the end so that you can do knowledge checks to make sure that you're retaining the information that you have read and reviewed. We have flashcards, and this is one of the features that I'm particularly excited about because this is something that people have been asking about for years. They are printable, they are downloadable, so you will have access to flashcards on key terms and definitions so that you can quiz yourself till the cows come home. So we also have a resource center, a glossary where you can look up terms. And then there's reports that will also show your progress. So you can see where you are in the totality of everything that the learning system offers. And then finally, when you've gone through everything, there is a post-test as well. And the post-test, really the objective is to simulate the experience that you're going to have when you actually take the exam. So you'll be able to see, okay, I spent X amount of time on these questions so that you can really help plan and feel like you have been set up for success when you actually take the exam. So next slide, please. So as Natasha mentioned at the very beginning, we really wanted to spend a lot of time talking about the content creation process and the rigor that went into this. And I will just sort of do a little bow to our SMEs because they were just so fantastic, not only to work with, but such experts in this field that really made sure and were very, very dedicated that we were providing you with the information that you need to be successful in serving in a long-term care space. So we took the CIPIC content outline, and you'll hear me talk about this again in just a moment. That was our North Star. So the content outline is also called the test specifications on CIPIC's website, and I'm actually going to pop that link in the chat. And sometimes you actually have to navigate to the second tab on CIVIC's website for the LTC specific content outline, or again, test specifications, because if you download the PDF, that is what it is called. But all of that is to say this was our North Star. We always wanted to make sure that we were providing content that always came back to what the exam was, you were going to be tested on, and what the exam would be covering. So we took all of that. We created content. There was review and validation, which our SMEs are going to talk more about in just a moment. So again, all of that is to say a lot of rigor and attention to detail went into making sure that we were putting together content that was going to teach you, but also again, help you pass the exam. So next slide, please. So before I toss it over to our SMEs to talk a little bit more detail about each of the modules, I just mentioned that the content outline was our guide. Also on CIVIC's website, they have a list of primary resources that were used in the development. We also used those when we were putting the content together as references and resources. So for example, some of that includes the APIC text, the APIC's Infection Prevention Guide to Long-Term Care, the CDC's Advisory Committee on Immunization Practices. So that full list can be found on CIVIC's website, but I just wanted to mention that all of those resources also went into the development of these module content. So I am now going to turn it over to my friend Deb, who's going to talk a little bit more about Module 1.
Hello. So I'm going to start with Module 1, and then everybody who had significant input or was the primary reviewer, we'll talk about theirs. Module 1, long-term care settings. First of all, we all know that each long-term care community sort of has its own personality, each level of certification, each level of licensure. So what we wanted to make sure that, in order to have a successful infection prevention program, you sort of have to know your facility, your resident / patient population, and your settings, and your building. So that's basically what a lot of long-term Module 1 goes through. It goes through the interdisciplinary team. It goes through the types of licensure and certification you may be dealing with, the types of services that you provide, different types of services for different types of settings. And the other thing I was going to say, thank you very much, Letty. I mean, yes, this held true to the outline for CIVIC, because we want to make sure that it's a situation where you are getting the information to be successful, because we want people to be successful. But the thing that I will tell you is that when, at least I know for myself and everyone else that I worked with, it wasn't a situation of teaching to the test. It's teaching to the core principles of infection prevention and control, and how those core principles work in long-term care. So you will find sections on the Ombudsman program. You will find sections on different services, dialysis, hospice, all of the other things are spelled out in Module 1 that relate to the overall, the higher review of long-term care settings. So Evelyn, do you want to talk about microbiology?
That's everyone's favorite subject, right? So thanks, Deb. And I just want to reiterate the process of how we did this. Each module was assigned a primary reviewer and a secondary reviewer. So everyone worked on everything in some capacity. And I think one of our major goals was to make this very unique to the nursing home and the long-term care setting, and not let our acute care background and everything kind of drift in there. Although, as Deb mentioned, all of those concepts related to infection prevention and control are certainly identical. So, Module 2, the microbiology, epidemiology, and normal aging process may sound like one of the more intimidating topics when you look at the table of contents, but we really begin this module starting off with just some basic definitions that we commonly use related to infection prevention that help us establish our framework for discussion throughout the rest of the module. For example, one of the first definitions that we address is just the difference between colonization and infection, to help everyone really orient themselves to where we're going. And then we also focused on the very complex interactions between microorganisms and the human body, in the context, again, of the long-term care resident. And we wanted to review not only how the immune system functions, but how some conditions that you guys see often, like poor nutrition and medications, can have an impact on your residents' overall immune response. Some of the other topics we covered you're very familiar with are the infectious process and some epidemiologically important microorganisms that we commonly see in the long-term care setting, such as multi-drug resistant organisms, C. difficile, influenza, RSV, and norovirus. And then, in addition to not only going over those processes, we wanted to talk about some strategies of what constitutes an infection, what's the epidemiology of how an infection occurs. And I know you're very familiar with the term, the chain of infection, and we'll talk about that in this module as well. And we not only talk about the infectious process, but also some strategies to mitigate and interrupt that transmission of infections. One that we included that you may not think as much about is the importance of specimen collection, transport, storage, and then when those tests come back, the interpretation of those results. Clearly, the initiation of isolation precautions based on the route of transmission is extremely important. The role that environmental cleaning and disinfection plays in reducing the risk of transmission, and that will be spoken to in other modules in greater detail as well. And then the last part of this module is we really looked at the importance of vaccines and their contribution in infection, reducing the risk of infection transmission and helping us really understand what they are and how they work exactly. So that kind of sums it up for module 2. And then I happen to be the primary person on these 2 consecutive modules. So we'll just talk a little bit about module 3, which is a very, very comprehensive overview, detailing the elements that you really need to make sure are in place in your infection prevention and control program in order to make it robust and successful, and something that's going to provide the ultimate safety for your residents and your staff. In this module, we look at those risk-related analysis at the community level, at the facility level, and then at the infection control level with your infection control risk assessment. And this, as Lady mentioned earlier, we not only have the verbiage, but we also have tools and examples that you can use and modify to meet your needs. And then obviously this section would definitely talk a little bit more about some of the regulatory requirements of your infection prevention and control program. We look at who the core members of your team should be, what their responsibilities should be, and how important it is to make sure that resources are allocated to make that successful. And not only do we describe the program, we give you some tips on implementation, through your policy and procedure development process, through your education, not only of staff, but residents and the caregivers. Product evaluation, excuse me. Product evaluation is an extremely important part of your infection prevention program. And then surveillance is a main key stakeholder to your program. And Jackie's going to talk a lot more about that in just a minute in module 4. Again, this was a very comprehensive module. We also had a very detailed discussion about antimicrobial stewardship programs, antimicrobial susceptibility and resistance patterns, recognizing that appropriate use of antibiotics and antimicrobials is really the cornerstone of our resident safety and positive outcomes. And then finally, I think we would all agree that infection prevention is regardless of the setting, but especially in the nursing home setting, will wear a variety of hats and be responsible for and or participate in quite a few programs within the organization. So in this module, we address that infection preventionist role in research study design, focusing on those most commonly used study designs that could be applicable in your setting. And then also just kind of walking you through conducting a literature review so you can use that information to help inform your decision-making within your facility. We also talk about providing the IP's role in providing staff education and training and validating those competencies, recognizing that our healthcare settings are very unique because of the diversity of the staff. Participation in the quality assurance or assessment and performance improvement plan is just embedded in everything you do as an infection preventionist in nursing homes. And then the emergency preparedness plan. Really remembering that those processes include things like mitigation, preparedness, response, and recovery. And just all of those things, how they roll in together and what your role is in that. And then lastly, the safety and occupational health, which includes really establishing that safety culture and understanding the requirements of occupational health, including exposures and post-exposure workups, and then also just regular fitness for duty. So this is a very, very comprehensive module. And I will just say real quickly that one of the things I love about this training modules are that they provide you more information than you're even going to need to prepare for your exam. They're going to be a resource for you ongoing and just really provide you with a lot of good information that you need to do your job. So I think I'm finished. So Jackie, I believe you're up next to talk about.
Wonderful. Thank you, Evelyn. I appreciate that. And yes, it is a comprehensive guide to all elements of an infection prevention and control program. Now, I oversaw the module 4, which is surveillance of communicable diseases. And surveillance is an essential component of an effective infection prevention and control program. And this module includes topics on the basics of surveillance and surveillance design, surveillance methodologies and purpose, collection and compilation of surveillance data, outbreak management, as well as data management. Key principles and concepts of surveillance are provided, surveillance uses in long-term care and potential surveillance events, outcome and process events. We made sure we included the process events and other surveillance events, such as reportable diseases, outbreaks, and bioterrorism attacks. The components of a surveillance plan and evaluation are covered along with an example of a plan evaluation checklist. So you can ensure you have all components in that particular plan. Also included are the types of surveillance that can be conducted, i.e. targeted, comprehensive, concurrent, and retrospective, as well as checklists to conduct process surveillance. Categories of data collected are listed and sources of data to conduct surveillance, as well as considerations for choosing the type of surveillance based on the organization's services, as Deb alluded to, the population served, and resources available to the IPC program. This module also includes a method to identify an outbreak and essential components in response to an outbreak. Also covered is a review of the different surveillance definition criteria that can be used, converting, calculating, and displaying surveillance data into usable information to create action plans to improve outcomes. All the information covered in this module will need to be shared with your stakeholders, key stakeholders. This module also includes an overview of an effective communication plan for an IPC program. And, I just want to make that point of effectively communicating the IPC program design and accomplishments will provide a good foundation for a business case to secure or retain the necessary resources for the IPC program. That's it for me. Thank you.
So thank you, Jackie. So included in module 5, which is prevention and control of communicable diseases, are the topics of standard precautions, transmission-based precautions, cleaning, disinfection, and sterilization practices, as well as injection safety and safe sharps disposal. Now, for each of these topics, we not only review the basic concepts, but also other important considerations for you as an IP, such as product selection and location. Where do you put all these products that you have? Evaluation of staff understanding and compliance. For example, with use of ABHR, PPE, and even different types of disinfectants. We also review some associated regulatory requirements. Specifically for standard precautions, we review all the things you would expect, right? Hand hygiene, PPE use, respiratory hygiene, environmental cleaning, and safe injection practices. The types of transmission-based precautions that we discuss are contact, droplet, airborne, and enhanced barrier. Next, we're going to differentiate between cleaning, disinfecting, and sterilization because we know they're different processes, as well as the pros and cons of various disinfecting agents. The Spalding classification system, which guides staff in properly cleaning and disinfecting medical equipment, is then summarized. The importance of environmental cleaning to reduce transmission of healthcare-associated pathogens is discussed with a focus on high-touch surfaces, textiles, and electronics. Finally, we consider sharp safety practices and sharps disposal to protect staff and residents from bloodborne pathogens. Included in this section are the immunizations recommended for long-term care residents. And so now I'd like to turn it back over to Deb for Module 6.
Hi, everybody. As you've heard from Linda and Evelyn and Jackie, there's a lot of content in here. So Module 6 really focuses on those interdisciplinary departments that a lot of times the infection preventionist, when you've really sort of been housed under nursing, doesn't really think about as important pieces of a comprehensive infection prevention and control program, but they are. So it's concepts of food safety, how food is being handled, how it's being stored, how it's being prepared, how residents are being fed, looking at foodborne outbreaks, talking about hazardous analysis and critical, points when it comes to food safety, which is really important. You just don't think about stuff like that. The other, laundry, as people were talking about how to manage laundry, because that is a very important component, potentially component of infection prevention and control. But think about the other people that you've got in your building, helping to support your residents and your patients. So beauticians, cosmetologists, nail care, dental care, podiatry, all of those pieces are very important pieces of a comprehensive infection prevention and control program. Your hospice providers, all of those types of things. And then we get into how your building, your plant management is working. So your water systems, your ventilation systems, as we've had shown, there needs to be a lot more emphasis on ventilation and appropriate care of air and air exchanges and air handling within congregate care settings. So those are some of the things that are really focused on in this module 6 that should really help you understand better the role. And in the same way Evelyn and Linda and Jackie were talking about, this isn't just for the test. This type of information is critical for you moving forward. It's a wonderful resource moving forward in making sure that your infection prevention and control program in general is on the right track and stays on the right track. And it'll allow you to show people the scope of what an infection prevention and control program is, which, as Jackie was talking about, helps you build that business case.
Yeah, Deb, I'm so glad, you made that point that it's comprehensive, it's contracted services, it's services that are delivered within the facility for the employees, and you have to really have a feel for everyone that enters the building. And I think with the pandemic, that really hit home in many areas where IPs may not have even looked at those particular services. So thank you.
Well, thank you to our SMEs for sharing all of that great information. Before we open it up to questions, we figured since you're here wanting to hear how to prepare, you're also probably interested in sitting for the exam. So we thought we would just spend a quick moment, and I just posted this link in chat about the eligibility requirements that CPIC has outlined to sit for this exam. So this is nothing that APIC has any influence over, but again, we thought it would be helpful for you to share. If you have any questions, I highly recommend you email info@cbic.org for further information. I will say last week, Jessica Dangles, the executive director, and 2 of their board members did a webinar giving an overview of the exam. And so if for whatever reason you were not able to join us, I'm popping in the chat the link to the on-demand version so you can sign up for that. And learn more about the exam. I know they do talk a little bit more about these requirements during that webcast as well. So I thought that that would be a great resource for you to have. Before we open it up to questions in just a moment, I wanted to just send a quick reminder that once you sign up to take the exam, you have to take the exam within 90 days of when you sign up for that. So I share that because you really want to make sure that you feel like you are ready to take that exam when you sign up, or you're really close to taking that exam. So that is just a tip, some advice that we've heard from others that people may not be aware of that I wanted to mention. The final thing that I will share that I'm particularly excited about is we are going to be offering a scholarship program to have the learning system as well as to take the exam. And so we are working on the final details. The application period will open June 1st. So more information to come on that, but I just wanted to mention that to you all because that's something that is new because the certification and this prep material is new. So I know there have been a couple questions in the chat about where you can find out more information. So I'm gonna pop our website into chat as well because you can actually do a demo of the learning system. You can download a free reading example. You can take a test to see which certification is right for you. So I just wanted to mention that before we open it up to other questions. So thank you all, and we look forward to answering the questions that you have for us.